Welcome back to the deep dive. Today we're trying to unlock a really vital toolkit. It's for navigating what often feels like a huge maze, the world of mental health support. We spent a lot of time with the sources you shared, and honestly, they give such a complete picture, not just, what support is out there, but how you can actually get the right kind of mental health care. It's definitely complex. But our goal today, to map out some clear paths for you, maybe offer a few surprising insights along the way.
It really is complex. Yeah. And that complexity is exactly why this deep dive feels so important right now. I mean, think about it. There's just so much information flying around. Cutting through all that noise to figure out where to even start looking for help, that's critical, especially because everyone's situation, everyone's needs are so different. This isn't just about, reading off a list of services. It's about giving you the tools to find the help that's right for you and hopefully make that process a bit easier.
Okay, so let's unpack this then. When we talk about mental health resources, it's rarely just one thing, is it? Our sources immediately point to this whole spectrum of professionals who are ready to help. So who are these key players, and what's the really critical difference we need to wrap our heads around?
Yeah, that's exactly the right place to start. The landscape of professionals is really diverse. It's designed that way to meet all sorts of different needs. So at one end, you've got psychiatrists. Now, these are medical doctors, MDs, who specialize in mental health. And because they're medical doctors, they can diagnose conditions and they can prescribe medication. So think of them as maybe your first point of call if medication seems like it might be part of the picture.
Right, so medication potentially involved. Psychiatrist is often the direction.
Mhm.
Okay, what about psychologists then? How do they fit in? What's their specific role?
Psychologists are, well, they're distinct. Their main focus is on psychotherapy, what most people call talk therapy. They have tools for assessment, for diagnosis, absolutely. But they don't prescribe medication. So if your primary need is working through things with therapy, or maybe, psychiatrists are just hard to get an appointment with in your area, a psychologist is a fantastic resource.
Okay, that distinction is really helpful for people just trying to figure out where to even begin.
Yeah.
Um, Beyond those two big ones, who else might you encounter on the sort of care team?
Oh, the team can be quite broad, actually. You'll definitely find licensed social workers and counselors, other kinds of licensed therapists, too. They all offer various forms of psychotherapy. But here's something really valuable, something maybe not everyone realizes. The growing role of psychiatric mental health advanced practice registered nurses. We often call them PMH APRNs. You can think of them as highly skilled nurses, right? They've done advanced training, and often they can do a lot of what a psychiatrist does. Things like prescribing medication, doing really thorough assessments, diagnosing and treating illnesses, even ordering lab tests sometimes. They're a really, really great resource, especially in places where psychiatrist access is limited.
That's a really important point about the PMHAPRNs, yeah.
Yeah.
They definitely broaden the options for getting good care. And, okay, beyond the licensed clinicians, the sources also brought up a different type of support, one that's more rooted in, like, shared experience.
Absolutely. And this is a different flavor of support, but just as vital for many people. You have certified peer specialists. These are folks who actually use their own lived experience, their own journey through mental health challenges to guide and support others going through similar things. It's a really powerful model based on connection and genuine understanding.
So we've kind of mapped out who can help, but like you said, finding the right person is maybe only half the battle. The next really crucial piece is where. Where does this care actually happen? Let's dig into the settings and services because the sources highlight a huge variety. Where do people typically get this kind of care?
The settings are just as varied as the professionals, really. Again, designed to meet you where you are. So, on the outpatient side, meaning you're not staying overnight, you see patient-centered medical homes. These often try to integrate mental health right into your regular primary care. Makes a lot of sense. Then you have community mental health centers. These are so important because they often provide care that's free or low cost or on a sliding scale based on income, really vital for people who might not have insurance. You also find specific county programs offering similar community-based help. And for people who can't easily leave home, there's psychiatric home care, making sure support gets to them. Even places like correctional facilities have dedicated psychiatric mental health care services.
That's a really broad range of in-person options, but, life happens. It's not always easy to make it to an in-person appointment, or maybe someone needs something, I don't know, a bit more intensive than just a weekly chat. What kind of solutions did the sources point to for those situations?
Yeah, that's where things like telepsychiatry and teletherapy have become so incredibly important. They offer therapy and even prescription services remotely over video or phone. These really, really took off during the pandemic, obviously, and they've made a huge difference in access for so many people. You can even do group therapy remotely now, which helps build that sense of community even if you're miles apart. And for those needing more structure, more intensity, there's partial hospitalization. That's where clients get daily assessment and therapy, but they go home at night, and also intensive outpatient services. These are often a step down from, say, residential treatment or maybe a starting point. You see them used a lot for substance use disorders.
Okay, so there's this kind of a flexible range of outpatient care. But what happens when things get really serious, really acute, or if someone needs, like, round-the-clock support? When does inpatient care become necessary?
Right. So when an acute crisis hits, maybe severe psychiatric symptoms or a risk of self-harm, emergency departments are often that first point of contact. Then within general hospitals, you often find acute care psychiatric units. These are typically locked units, really focused on immediate safety and stabilization, getting things under control. For clients who might have chronic serious mental illness or perhaps need care related to the legal system, there are state-operated psychiatric hospitals. These offer longer-term support. And if someone needs medically supervised withdrawal, like from substances, or just needs 24/7 medical care alongside psychiatric support, there's medically monitored and managed inpatient care. And finally, residential services. These offer structured 24-hour support, but outside of a hospital setting. They're good for individuals who are, physically and emotionally stable enough, but still need that supportive living environment.
Wow. Okay, it's actually quite reassuring to hear there's a setting designed for pretty much every level of need. But support isn't always, formal clinical treatment, is it?
No.
Our sources really emphasize the power of shared experience, too, in things like support groups and mutual aid groups. Which ones should our listeners know about?
Oh, absolutely. These groups are just invaluable for connection, for feeling understood. The National Alliance on Mental Illness, or NAMI, that's a really big one. They do amazing work improving lives, reducing stigma, lots of education, support, advocacy. They even have a specific course, NAMI Homefront, for families and caregivers of military service members. We also see the Depression and Bipolar Support Alliance mentioned. And for substance use, of course, the well-known 12-step programs like Alcoholics Anonymous, AA, and Narcotics Anonymous, NA, they're foundational, really, with lots of variations now for different needs.
And what about for families? Because when someone's struggling with substance use, it affects everyone around them, right?
Exactly. That's where Al-Anon comes in. It's a crucial mutual aid group specifically for family members dealing with a loved one's substance misuse, and it includes Alateen for teenagers in that situation. Beyond those specific conditions, general resources like Psychology Today, they have directories too. You can often find a support group for almost any challenge you might be facing.
Okay, that covers a lot of ground for ongoing support. What about those moments when help is needed right now? Like in a crisis situation? What crisis hotlines and emergency services are out there?
Yeah, for an immediate mental health crisis, the 988 Suicide and Crisis Line is, well, it's a game changer nationwide. It gives you direct access to trained, compassionate counselors. Just dial 988. If a situation is escalating, maybe serious, but not immediately life-threatening, you can often call a local county mental health crisis unit, or sometimes they have dedicated mobile crisis response teams. And this is critical. If a situation is life-threatening or involves serious risk to property, always call 911. The sources strongly recommend, if possible, specifically asking for a crisis intervention training officer, a CIT officer. They have special training in de-escalating mental health crises. And for anyone experiencing intimate partner violence, the National Domestic Violence Hotline is there for immediate resources and safety planning.
Okay, so there are clear lifelines to call if someone's in immediate distress. Good. Now, beyond these direct services, the sources also pointed to some broader, almost foundational resources, like the backbone of the mental health information system. What are those key agencies and organizations people should know about for reliable info?
Right. These are your go-to places for trusted public health information. The Substance Abuse and Mental Health Services Administration, or SAMHS. They lead public health efforts in behavioral health, have great evidence-based resources. Medline Plus from the National Library of Medicine and the National Institute of Mental Health, NIMH, both offer extensive, reliable info on disorders. The World Health Organization, WHO, provides that global perspective, guidance, tools. And then resources like the Suicide Prevention Resource Center offer specific tools, maybe for patient safety planning. The Autism Society provides specialized support for kids with autism and their families. These are all really excellent starting points if you're just looking for solid, reliable information.
Okay, that's a really comprehensive overview of the resources themselves. But how does someone actually get connected to these services? How do they get referred? It sounds like there's often a specific, maybe even intricate process involved.
There absolutely is a process, yeah. And often it kind of subtly begins with healthcare professionals, nurses, in particular in all sorts of different care settings. They're often on the front lines, right? They might be the first ones to notice subtle signs or symptoms of mental health issues. Maybe just during a routine physical exam, they observe certain behaviors or hear about difficulties someone's having in their daily life. It's about looking beyond just the immediate physical complaint.
Okay, so it often starts with just that initial recognition, an observation by a professional. What happens after that kind of spark of concern?
Well, once those concerns pop up, the next crucial step is assessment and screening. This often involves things like a mental status examination, maybe a psychosocial assessment, to gather that subjective data, how the person is feeling, what their behaviors are like. And a really critical priority now for anyone age 12 or older admitted for acute care is screening for suicidal ideation. They use validated tools for that, like the patient safety screener. For substance use screening and brief intervention, SBI is really key. It's about gently motivating people to maybe acknowledge risky behavior and think about making a change.
And how does cultural understanding fit into this assessment piece? Because I imagine that could hugely impact how someone even talks about their problems or what they see as a problem.
Oh, it's absolutely vital. The sources really emphasize using tools like the cultural formulation interview questions. This is all about trying to understand the problem from the individual's unique perspective. Taking into account their cultural background, what they consider potential sources of help, what their expectations are for services. It helps ensure a more holistic approach, one that's culturally responsive instead of just applying some generic one-size-fits-all model. It really respects where the person is coming from, their worldview.
Okay, so once that really nuanced assessment is done, how does that actually lead to getting specialized help? What's the pathway to connecting them with the right kind of specific support?
Right. So if a problem, especially something like substance use, meets the criteria for an actual disorder, or maybe those brief interventions just aren't enough, then a referral to specialized treatment becomes the next step. This whole comprehensive process, especially for substance use, is often called screening, brief intervention, and referral to treatment, or SBIRT. The absolute key here is that the referral for further assessment for developing a clinical treatment plan should always be tailored specifically to that client's needs. And, effective referral processes, they really focus on motivating the client to actually accept the referral and then helping them navigate any practical hurdles like transport or cost. It's definitely not just about handing someone a phone number.
That makes a ton of sense. Yeah, it's not just pointing the way, but actually helping them build the bridge to get there. What about when someone is leaving care, like being discharged? Are there specific referral steps then to make sure things don't just fall apart?
Discharge planning is. You could argue it's one of the most critical parts of this whole referral process. Nurses provide really clear written information about follow-up care, especially crucial for clients maybe at risk for suicide. That info needs to be shared with family members too. Developing a safety plan with the patient, providing those crisis hotline numbers, these are key strategies shown to help decrease suicidal behavior after discharge. For clients with substance use disorders, it's about developing a collaborative post-withdrawal treatment plan. That means working with the interprofessional healthcare team, considering the client's own goals, their readiness for change, and making clear referrals to the right kind of residential or outpatient programs or recovery support. It's really all about setting them up for success once they leave the facility's walls.
Okay, so the referral process is really multifaceted. From that initial noticing all the way through to detailed discharge planning. This brings us to a really crucial point you touched on, effective collaboration. How do all these different mental health professionals actually work together to make sure care is coordinated, that it's seamless for the patient?
Collaboration is, well, it's truly the cornerstone. Without it, the whole system just fragments. Psychiatric mental health nursing, for example, relies so heavily on working within these interdisciplinary teams. That means nurses are constantly collaborating with psychiatrists, psychologists, social workers, occupational therapists, you name it. When you're assessing and addressing really complex issues, like maybe the family dynamics affecting a child's mental health disorder, you absolutely need that team approach. Everyone brings their unique perspective, their unique skills to the table.
I can definitely see how that team approach is essential. But practically, how do they share information? How do they communicate effectively to keep everyone in the loop, especially when there are so many different people involved?
Yeah, shared information and consistent communication are just vital. The nurse-client relationship itself is key fostering therapeutic communication, really involving the client in their own care decisions. Nurses have a big responsibility to accurately document everything, assessments, interventions, progress, and make sure that information is easily accessible to the whole team and quickly. Crucially, any changes in a person's condition, they need to communicate that immediately. For clients at risk of suicide, for example, their level of risk and the plans to reduce that risk have to be comprehensively documented and communicated across the entire team. Nurses also report those subtle trends they might observe. Maybe someone is cheeking their medications, pretending to swallow them, or showing increased agitation. Getting that info to the team promptly so everyone's aware is key.
So constant, clear, proactive communication is the glue holding it together. How does this collaboration then translate into an actual integrated personalized care plan for the patient?
That integrated care planning, that's where it all comes together. And when it works well, it's really a testament to patient-centered care. Treatment plans, especially, say, for substance use disorders, they are designed collaboratively with the client. It's so important. They're meticulously tailored to the individual's specific needs, considering everything: age, gender, race, ethnicity, language, even things like health literacy, religion, sexual orientation, any history of trauma, and of course, any co-occurring physical health problems alongside the mental health ones. Nurses play a huge role in actually implementing these collaborative interventions, whether it's giving medications or facilitating different therapies. Like during an acute manic episode, nurses work closely with the whole team to manage meds, help the person sleep, make sure basic self-care needs are met. It's a real team effort focused on that individual.
It really sounds like the patient is, or at least should be, right at the center of this collaborative effort, which is how it ought to be.
Wow.
What about advocacy within this system? Where does that fit in for the professionals involved?
Advocacy is a huge and sometimes maybe unseen part of the role, especially for nurses. Nurses often advocate for the medical treatment of existing physical conditions in people with severe mental health or substance use issues. These individuals are often at higher risk for preventable physical diseases, but might avoid seeking physical care. They also champion the delivery of care that is dignified, respectful, and truly person-centered, making sure the whole team adheres to that. And it's not a one-time thing. The treatment plan has to be continually evaluated, modified as needed, to make sure it's still meeting the person's changing needs over time. It's really about being their voice, their advocate within that complex system.
This collaboration sounds incredibly robust when it works well, a real testament to teamwork. But even with the best teams, just navigating the mental health care system itself can be a massive challenge. What are the key accessibility issues, insurance hurdles, and other sort of real-world barriers that the sources highlighted, the things people really need to be aware of?
You've definitely hit on maybe the biggest hurdles people face. Navigating the system means understanding several layers of barriers that go way beyond just finding the right doctor. First off, just accessibility to services. This can be hugely impacted by where you live, your geographic location, the infrastructure available, particularly in rural communities, right? Where maybe long-distance transportation is a major problem. Or even just not having reliable internet access for teletherapy can completely cut someone off from care.
Right. So your zip code can literally determine your access.
Right.
What about the availability of the professionals themselves? Are there enough people to provide the care?
That's the next huge barrier: workforce shortages. There's a significant lack of trained healthcare providers across the board, especially certain specialists like child psychiatrists or geriatric psychiatrists. And there's a national shortage of inpatient mental health beds and also residential facilities for substance use treatment. This often leads to just incredibly frustratingly long wait lists for all sorts of services, which really hinders getting timely care. Imagine being ready to get help, finally asking for it, and then being told you have to wait months. It's tough.
Yeah, that's incredibly discouraging. And then, of course, the elephant in the room.
Yeah.
Money. How do insurance and costs factor into all this?
Yeah. Financial issues are a massive, massive barrier. A really significant number of people just don't seek treatment for substance use or mental health problems simply because they lack healthcare coverage or they can't afford the treatment, the co-pays, the deductibles. While places like community mental health centers can offer free or low-cost care, nurses and other providers still really need to educate clients about the potential costs involved: psychotherapy sessions, medications, and talk realistically about their ability to pay. It's a very real financial burden for so many individuals and families.
So even if you find someone, can you actually afford to see them? Wow. What about barriers that are more cultural or social? These can be subtle sometimes, but incredibly powerful in stopping people from even seeking help in the first place.
Oh, absolutely. Cultural stigma is a major, often invisible barrier. The sources mention nearly two-thirds of people with diagnosable mental health disorders don't seek treatment, often because of stigma. Mental health challenges can still be viewed wrongly as a personal weakness or something to be ashamed of. That makes reaching out incredibly difficult. We see this particularly acutely sometimes with racial and ethnic minorities and other historically marginalized communities. They might be less likely to access treatment, or maybe they wait until symptoms are really severe. This can be due to stigma within the community, or sometimes a deep seated, often historically justified mistrust of healthcare providers and the healthcare system itself. It makes it absolutely crucial for care providers to be acutely aware of how culture, race, ethnicity, religion, even geographical origin might impact how a patient experiences and expresses symptoms, their help-seeking behaviors, and who they see as their support system.
That point speaks so powerfully to the need for real cultural competence in care, doesn't it? It makes you realize that sometimes the biggest barrier isn't a lack of beds or doctors, but a deeply ingrained belief system or past negative experiences. It really underscores the power of understanding a person's whole world, not just their diagnosis. Okay, what about patient rights and legal protections within the system? It must be critical for people to understand what their rights are.
It's absolutely fundamental. The Patient Self-Determination Act, for instance, outlines really crucial rights for individuals admitted to mental health units. These include the right to appropriate treatment and, importantly, treatment in the least restrictive setting possible, the right to an individualized treatment plan, the right to actively participate in planning that care, the right to have treatment objectives and risks clearly explained, and, critically, the right to informed consent, meaning you agree to treatment based on full understanding. Patients also have rights regarding freedom from restraint or seclusion. Those should only be used in true emergencies, the right to access their own medical records, and robust privacy protections under laws like IPA. There are even tools like psychiatric advance directives or PADs. These let individuals outline their preferences for future mental health treatment or name someone to make decisions for them if they anticipate a crisis where they might not be able to express their wishes. It's sort of like a living will for your mental health care. And for situations involving emergency or involuntary admissions, there are specific legal procedures and protections in place to ensure rights are upheld. The emphasis is always, or should be, on maintaining human dignity even in a crisis.
That's a lot to keep in mind when navigating the system, for sure. But knowing this information really helps empower the individual, doesn't it? Okay, so to try and pull all this incredibly valuable information together, our sources suggested the idea of creating like a resource guide or a toolkit for someone. How would we distill everything we've talked about into a truly actionable guide? What would the key sections look like?
Yeah, a really comprehensive toolkit would aim to empower individuals by giving them a clear roadmap. It would probably start with a section on understanding mental health and wellness. You know, laying that foundation, defining mental health, explaining what mental illness is, introducing the concept of the mental health continuum, that idea that it ranges from well-being all the way to emotional problems or illness. Crucially, it would cover how to recognize early signs, talk about common causes or contributing factors to mental illness, and really emphasize the concept of recovery, stressing that mental illness is treatable, it's not a life sentence.
Right, setting that foundational understanding first. Makes sense. What would come next to help someone actually identify their options?
Next up would probably be a section detailing types of mental health professionals and what they do. But going beyond just the names, right? It would explain the primary care provider's role as often a crucial first contact. Then it would really break down the unique roles and the practical applications of psychiatrists, psychologists, social workers, counselors, those psychiatric mental health nurses we talked about, and certified peer specialists, focusing on when and why you might seek out each specific type of professional.
And then the actual treatments and support options available, this feels like, where the rubber really meets the road for someone seeking help.
Exactly. The mental health treatment and support options section would need to be pretty extensive and practical. It would cover the various forms of psychotherapy, individual, group, couples, family therapy, and maybe explain some specific well-known modalities like cognitive behavioral therapy, CBT, which helps you kind of retrain harmful thought patterns, or dialectical behavior therapy, DBT, which focuses a lot on managing intense emotions and improving relationships. Interpersonal therapy, IPT, looks at how your relationships impact your mood, And yeah, even engaging approaches like play therapy or music therapy. It would also need to overview psychotropic medications, antidepressants, mood stabilizers, anti anxiety meds, antipsychotics, stressing the importance of patient education about how they work and common side effects. Other strategies, too, like mindfulness practices, maybe milieu therapy, which focuses on creating a therapeutic environment itself, coordinated specialty care specifically for first episode psychosis, and recovery support services, highlighting the practical benefits of each.
That sounds incredibly practical. How would the guide then help someone actually find help and sort of get into the system beyond just knowing what's theoretically available?
Right, the finding help and navigating the system section. This would cover those crucial first steps. How do you even start a conversation about mental health? Understanding confidentiality, patient rights under HIPAA, and the Patient Self-Determination Act. Crucially, it would need to directly address those common barriers we discussed: stigma, cost, accessibility, and really underscore why cultural competence is so important when you're seeking care, making sure you feel understood and respected. It should also provide clear, actionable steps for crisis situations and emergency interventions, like immediate suicide prevention strategies, and offer practical resources specifically for families and loved ones who are trying to support someone through this.
Okay. And finally, are there any kind of overarching important considerations that would tie everything together in this toolkit?
Yes, definitely. A final important consideration section would emphasize principles that should really guide all mental health care. Things like evidence-based practice, making sure the care you receive is actually based on current, validated scientific research. Patient-centered care, highlighting again the absolute importance of individualized treatment plans that are based on your preferences, your goals, and critically, trauma-informed care. This is so important. It's a strengths-based framework that recognizes how prevalent trauma is, and it emphasizes creating physical, psychological, and emotional safety. It's about giving control back, empowering survivors. This includes practices like, providing anticipatory guidance, explaining what will happen before it happens, always asking before touching someone, protecting privacy diligently, and using clear, simple language. It's really about creating an environment where healing can actually begin, especially for those who've experienced trauma.
That's a truly comprehensive guide. And framing it that way really does shift the perspective, doesn't it? From seeing this as a daunting maze to seeing it as a landscape you could actually navigate. We've covered such extensive ground today. From that wide array of mental health professionals and all the different treatment settings, through the sometimes intricate referral processes, the huge power of collaborative care, and also facing those very real-world barriers people encounter when trying to get support. Having this kind of deep knowledge, it really does offer a vital toolkit, whether it's for you or for someone you care about.
It really does. I think this deep dive shows us the incredible breadth of support that is available, but it also highlights that crucial, sometimes overlooked human element that's so critical to making it all work. We've explored just how important patient-centered care is and trauma-informed approaches, and why understanding someone's cultural context, their lived reality, is just as vital as any diagnosis or treatment plan. What's truly fascinating to me looking at all this is how often the simplest, most human acts, things like really actively listening without judgment, genuinely respecting someone's unique journey, or advocating for dignified, respectful care, how often those become the most powerful interventions within this whole complex system.
So what does this all mean for you listening right now? Well, it means you have the power to understand, the power to navigate, and the power to advocate for effective mental health support, whether that's for yourself or for the people around you in your life and community. Thank you so much for joining us on this deep dive. We really encourage you to keep exploring this, keep learning, and apply this knowledge where you can.